Alright, hi, I'm Jessica. I'm going to do the abdomen assessment. So first, with the patient laying down, you're going to lift up their shirt and first start with inspection. You're going to inspect the skin for color, the skin color, symmetry, the shape, the contour. You can note any peristaltic waves of the abdomen digesting. You can inspect the umbilicus for symmetry, color, and you'll also be able to see any respirations in this abdomen if they're abdominal breathing or if one side's breathing and they're not symmetrical. Note for any skin abnormalities like any moles or just that it all looks normal. Then you're going to move into auscultation. So you'll take your stethoscope and you'll warm up your diaphragm, and you're going to start in the right lower quadrant and place the diaphragm down and give it some time to hear some gurgling of the abdomen working. You can hear anywhere from 5 to 30 gurgles, and then you work your way up to the right upper quadrant, going in a clockwise position, clockwise rotation, and the left upper quadrant, and finally ending in the left lower quadrant. If you don't hear anything, you need to listen for at least 5 minutes to say that no bowel sounds are present, and then you can describe what you hear. They're present, were they hyperactive, were they hypoactive, then you can use the bell of your stethoscope to auscultate for vascular sounds. And again, you'll work in a clockwise position. This is how you can assess for any bruits or friction rubs. Friction rubs are typically heard under the lowest points of the rib cage when they're rubbing together and they make a grating noise. Then moving on to percussion, this is how you will assess the organ size in the abdomen. And you'll work again in all 4 quadrants, assessing for tympany or dullness. Tympany is a sound, dullness, you're not hearing anything. So first we'll have them lift their shirt up and sit up and percuss for the kidneys, which will be in the lower portion of the back. And to percuss for the kidneys, and you will take your dominant, non-dominant hand flat and make a fist with your dominant, and you'll percuss if you hear dullness or tympany on either side. Also, sometimes maybe there'll be tenderness. Then moving on, we will percuss for the liver, and this is going to be located on the right side. And this is when you percuss with your non-dominant hand, and you do tapping with your dominant with your middle finger, and you'll percuss, noting for any tympany or dullness. Then for the spleen, which is on the left side, there are 3 ways, but my favorite way to assess the spleen is starting in the left MCL, which is a little higher, and then working down to the left MAL. Again, assessing if you hear tympany past the MCL, this could indicate splenomegaly, an enlarged spleen. Then for the bladder, you will start at the symphysis pubis and work your way up to the umbilicus, assessing for tympany or dullness. And normally a empty bladder will not be heard with percussion past the symphysis pubis. So if it's a distended bladder, you'll hear tympany upon percussion. Then finally is palpation. There are two types, light and deep. Light, when you do light palpation, you're assessing for tenderness. And so I like to work in the same way consistently throughout, and start in the right lower quadrant, and you'll push down about 1 to 2 centimeters, you know, seeing if the patient has any tenderness upon palpation, going all the way around, left upper quadrant, left lower quadrant, and just working your way around. Then for deep percussion, this is where you're going to assess for organs, masses, and tenderness. And for deep percussion, you will palpate 4 to 6 centimeters down, so deeper. And this is where you can, you know, if you're on the right side, you can percuss for the liver and, you know, see if they have any tenderness, or on the left side, percuss the spleen for any tenderness or masses. And just keep percussing the 4 to 6 centimeters. And that concludes my abdominal assessment.